Hello everybody. In this video, we are going to discuss about the os trigonum and the os trigonum syndrome. Os trigonum is an accessory bone that's present on the posterior surface of the talus. This bone is supposed to be fused with the talus, but it fails to fuse with it. It is connected to the talus with a fibrous connective tissue band. An os trigonum syndrome is when this bone, called the os trigonum, starts giving issues like pain or inflammation. The mere presence of an os trigonum is not sufficient to cause a syndrome. It must be accompanied with a trauma to actually cause the os trigonum syndrome. An example of os trigonum syndrome is when a ballet dancer points their foot, the forceful hyperplantar flexion results in displacement of the os trigonum. This thereby causes inflammation in the surrounding region. This is known as an os trigonum syndrome. Rest, ice, compression are some medical management techniques that can be used. One may also be given non-steroidal anti-inflammatory drugs or corticosteroid injections to decrease the inflammation of this region. A walking boot is recommended to keep the ankle immobilized. If these non-surgical approaches do not work out, a surgery might be required, which involves removing the os trigonum. Since the os trigonum is an accessory bone, removing it does not impair any kind of functioning. This surgery of removing the os trigonum in order to cure the os trigonum syndrome is proven to be highly effective with a very good success rate. I hope this video was helpful in clearing the concept of os trigonum and its associated syndrome. That's all we have for today. Thank you.